everyone, and thank you for joining the NeedyMeds special topic webinar, The Financial Impact of Cancer, presented by Triage Cancer. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds, and before we get started, I'd like to go over some tips so you can make the most out of today's presentation. First of all, if you have any questions, you can feel free to type them into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you via email as soon as we can. But of course, we will provide the contact information for both NeedyMeds and Triage Cancer also at the end of the presentation, so don't hesitate to reach out to either one of our organizations. This webinar is also being recorded and will be available for viewing on the NeedyMeds YouTube channel. And you can find copies of the PowerPoint slide decks accompanying this webinar in the handout section of your control panel. So with that, let's get started with what is NeedyMeds. NeedyMeds is a national nonprofit founded just over 2 decades ago by retired family physician, Dr. Rich Sagel. Rich is still our president. What you're looking at on your screen is all formal wording about our mission statement, our vision statement, and a statement about how we achieve our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. And I always like to put a screenshot of our homepage up, because our website really is the face of our organization, and it gives me a chance to point out a few things. If you're looking for healthcare savings resources, begin your search under the Patient Savings tab. If you're interested in educational information, such as ordering brochures and drug discount cards, signing up for webinars, or getting on a list to receive our monthly newsletter, you can do all of that under the Advocates tab. I mentioned that this webinar is being recorded and will be available on our YouTube channel, and you can find a link to that on the top right-hand side of our homepage with all of the other social media icons. It's the third one from the left. And we hope you do subscribe, because that way you will know when new content is being added and you won't ever have to miss a webinar, a presentation, or a video. And you can check out and register for all upcoming webinars also under the calendar of events on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And we do that, of course, by letting them know about NeedyMeds, but also by letting them know about other resources available, which is why we are so pleased to have our guest here with us today from Triage Cancer. Triage Cancer is a national nonprofit that provides education on the practical and legal issues that may impact individuals diagnosed with cancer and their caregivers. It's my pleasure to introduce Monica Bryant, Esquire, who is going to walk us through tips that will help lessen the financial impact of a cancer diagnosis and treatment. Monica is a cancer rights attorney, speaker, and author. She is the co-founder and Chief Operating Officer for Triage Cancer. Throughout her career, she has provided hundreds of educational seminars, written articles and blogs, appeared on TV and radio shows, and authored a book on cancer rights law. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Monica, so bear with me while we do that. And while that is happening, I will remind you that if you do have questions throughout Monica's presentation, you can go ahead and type them into that question section of your GoToWebinar control panel. And with that, I'm going to go ahead and pass the mic to Monica. That looks good, Monica. That's out of our way. We can see it really clearly, your presentation. So I'll pass the mic to Monica. Enjoy, everyone. Thank you for your time.
Thank you so much, Carla. I'm absolutely delighted to be here. We so appreciate our partnership with NeedyMeds because we really feel like collaboration is key to so much. I'm also going to ask all of you who are listening today to forgive me. I have managed to get my annual spring cold this morning, so forgive me if I sound a little bit nasally. But I want to start off with just telling you a little bit more about Triage Cancer, because even though we're going to spend an hour together today, we're really only going to scratch the surface of all of the different issues that can come up after a serious diagnosis. And certainly we are a cancer organization, so much of what I talk about is going to be through the lens of cancer, but it is also really applicable to anybody coping with a serious illness or a medical diagnosis, in which the treatment can be quite expensive. So again, we are a national nonprofit, and we provide information about all of the legal and practical issues that can arise after diagnosis. And we do that in a couple of different ways. So we participate in events all over the country. Some are ones that are put on by our partners in the healthcare community, and some are ones that we host ourselves. And so to see where we're going to be, you can take a look at our events calendar. We also host conferences that are really open
Monica,
to...
excuse me, I'm terribly sorry to interrupt.
No problem.
I just wanted to, I don't know if our audience is experiencing this, but there's, you seem to be coming out in and out just a little bit, and I'm wondering if it's because maybe your microphone is moving. So maybe just if you're able to adjust that a little bit. Thanks. Perfect. You're nice and clear now.
Okay, perfect. So please let me know if that happens
Thanks,
again.
everybody.
I am on the
Sorry
phone.
for the interruption. I absolutely will. Got it.
Technology, right? You got to love it.
Thanks, everybody.
Yep. So in addition to our Triage Cancer conferences, we host a monthly webinar series about a variety of topics that can be helpful when dealing with a serious illness. We do provide CEs to nurses and social workers, and we also record all of our webinars. So if you missed some or you'd like to see what we've spoken on in the past, you can always go to our website and watch those at your leisure. In addition to our events, we host a number of educational materials and resources online. We refer to them as our quick guides, which are really just a quick snapshot of a particular topic. You can see all of the titles that we have here, but again, they can be downloaded from our website for free, or you can order hard copies on our website as well. But we know that everybody learns in different ways, and not everybody is going to read a quick guide. And so we also have some educational animated videos on a variety of topics. And I'm going to point out where the ones that are relevant for today's topic come up. Now, where you live can impact what protections you have access to. So we have charts of state laws on employment, disability, health insurance, immigration, estate planning, and more on our website. Now, through the many years of doing this, people would often say to me, I wish that we could just put you in our pocket and you could be available to answer the questions when they come up. And since we haven't perfected that technology yet, we did the next best thing in creating cancerfinances.org. And this site provides practical information on topics that can impact your finances after a serious illness diagnosis. It's designed to guide you to information that's most relevant to your situation based on answering questions that the website poses. And we're constantly adding new topics. So again, I just wanted to tell you a little bit about our services. So if after today you have questions about other topics or would like more information, in addition to NeedyMeds' fantastic website, you have another place to go. So getting into the heart of today's topic, dealing with finances after a diagnosis. Now, if you've ever tried to put together one of those giant jigsaw puzzles at some point, it's challenging. Now, you could imagine that it becomes even more difficult to complete if you've never seen the picture of what that final product is supposed to look like. And that's how it can feel to a lot of people who are navigating this complex maze of cancer. They're diagnosed, they find out along the way that there's so many things that they have to think about and deal with, but they don't always have a view of the overall big picture. So through the various programs and resources that we provide, we try to give people that big picture so that they can put together their own puzzle. And just some of the pieces of that whole picture include the specifics of employer policies, federal and state laws, employment contracts, certainly other types of insurance policies you might have access to, and the financial and insurance piece. And all of these pieces are vital because it's in cases where people don't know what the law is that they can ultimately fall through the cracks. Now, in 2013, researchers out of Duke University coined the term financial toxicity. And in their research, they focused on the financial burden of a cancer diagnosis and how significant that burden can be, not just in an acute way when somebody's in active treatment, but also the long-term impact of that financial burden. And we're not just talking about somebody's bank account or financial health, but we also have data on how that financial burden is causing stress and depression and anxiety, and overall really diminishes quality of life. So this is a relatively new term, but it's certainly not a new problem. But there's no easy solution to the problem of financial toxicity because there are multiple contributing factors. And all or most of these factors have to be addressed effectively in order to mitigate financial toxicity. Now, the primary culprit of financial toxicity is having inadequate or no health insurance. But certainly, potential employment changes and then life changes that can impact somebody's financial health will continue to occur even after a diagnosis. So again, being able to navigate these different factors is the way that we can start to minimize or avoid financial toxicity. Now, I realize this is really challenging to read on the screen, but it's really just a visualization of all the questions that could be asked to help somebody address financial toxicity. And as you can see, it touches several aspects of somebody's life, from insurance to work, from practical issues to what their life looks like, kids, aging parents, sort of your day-to-day responsibilities. Now, because I realize it's very challenging to read on the screen, you can see at the bottom, you can actually go to this link and download a full-size version of this. And on that downloadable version, you'll not only see the questions on the left-hand side, but on the right-hand side, you'll see all the resources that we have at Triage Cancer to help people deal or address the answers to these questions. Now, we mentioned that health insurance status, so not having health insurance or even having inadequate health insurance, is the number one culprit of financial toxicity. One of the reasons for that is that health insurance is incredibly confusing. It's like learning a new language, but yet there aren't very many teachers teaching that new language. So if you feel like you don't understand your health insurance, please know that you are not alone. I've given you some statistics here from people who receive their health insurance through an employer. And as you can see, less than a quarter of them even understood the words being used in their policy. And only half of them knew what they were paying to have a health insurance policy. I would argue that health insurance is the only thing that we as consumers purchase where we have not a clue what it's costing us. So with that all being said, we're going to talk about some of the terms, because something as quote unquote basic as having an understanding of the terms used in a health insurance policy can make a significant impact. So these are terms that are often used but frequently misunderstood. When we talk about a premium, we're talking about the amount that you're going to pay monthly just to have health insurance. And you're going to pay this whether you go to the doctor or not. Then there are some costs that you're going to incur when you actually use your health insurance. The first is your deductible. This is the amount that you're going to have to pay before your health insurance company will start to cover their share of your medical costs. Now, their share is referred to as co-insurance or cost share, because you are literally sharing the cost with the insurance company. And it's always going to be given to you in a percentage. So for example, if you have a plan that has a 20% co-insurance amount, it means that your health insurance company is responsible for 80% of the costs of your care, and you're responsible for 20% of those costs once you've met your deductible. Now, some plans will also have something called a copayment, and that's the amount that you're going to have to pay each time you get care. So for example, many policies have a $25 copayment that you have to pay when you go to the doctor's office. Now, one of the most important things for us to know about our health insurance policies is what is the out-of-pocket maximum. And the way you get to the out-of-pocket maximum is by adding up everything you pay towards your deductibles, everything you pay towards your copayments, and everything you pay towards your coinsurance. So generally speaking, it's going to be everything that you're paying out of pocket except those monthly premiums. Now, I say generally because, of course, like with everything else, the devil's in the details. Typically, health insurance policies will only count payments made towards in-network services towards that out-of-pocket maximum. Additionally, we've seen some plans carve out the deductible from the out-of-pocket maximum. So it's really important to look at your specific policy. But the reason it's so important to understand your out-of-pocket maximum and what's included is because it is essentially the worst case scenario of what you're going to be paying throughout the year. So let me give you a quick example. Meet Dan. Dan has a plan with a $2,000 deductible. It's an 80/20 coinsurance, and his out-of-pocket maximum is $8,000. Dan gets into an accident, spends some time in the hospital that's in network, and ends up with a $102,000 hospital bill. So what's he responsible for paying? Well, the very first thing we always pay is that deductible, which leaves $100,000 left of the bill. His coinsurance is 20%, so that would equal $20,000. But does he have to pay that $20,000? He doesn't, because he has that $8,000 out-of-pocket maximum. So he's already paid $2,000 towards his deductible, so he's only responsible for another $6,000 of that bill. Now, I am not suggesting that $8,000 is not a lot of money. Of course it is. But when we look at the alternatives of a $20,000 bill without that out-of-pocket maximum, or certainly the $102,000 bill with no insurance, $8,000 starts to sound slightly more reasonable. Now, if you would like to hear what I've just talked about in terms of the terms and this example, it's all included in one of our animated videos called Health Insurance Basics, which is available on our website. Now, there are three main places that we get health insurance in the United States. The largest number of Americans get their health insurance through an employer. The next largest group get their health insurance through some sort of governmental program, primarily Medicare and Medicaid, but also that includes the military health plans and high-risk pools. And then the smallest number of Americans get their health insurance directly from a health insurance company. Now, within all of these options, many times people have the ability to receive what's called a managed care plan. And generally speaking, a managed care plan is just a plan in which there's a network of providers and your care is managed through that plan. But we have different options within managed care. So a health maintenance organization, or an HMO, is going to have a small network of providers. It's going to require that you start with a primary care physician. And if that primary care physician can't solve whatever problem you're having, then you get a referral to a specialist. So it's slightly less choice, and there's usually no out-of-network coverage. You have to stay within that network for coverage, but in exchange for that, you're going to pay the least. Now, an exclusive provider organization, or an EPO, is a bit of a hybrid. It's going to have a larger network of providers compared with an HMO, but there's no out-of-network coverage. You don't have to go to a primary care physician, so if you wanted to start with the specialist, you could within EPOs. So EPOs, you get a little bit more choice, a little bit more flexibility, you're going to pay more. And then finally, preferred provider organizations, or PPOs. These are going to have the largest network of providers. Many of them have some out-of-network coverage. It's not going to be as high as if you go to an in-network provider, but there'll be something. And you don't have to go to a primary care physician, so it can reduce the number of visits you're going to have. In exchange for the most amount of flexibility and the most amount of choice, you're going to pay the most for a PPO. Now, this is generally where folks ask me, well, which is better? What should I choose? And the honest answer is, it depends. There's no one-size-fits-all with this. We travel all over the country, and there's some places that have wonderful HMOs, and why would you go anywhere else? There's some places where the HMOs really aren't all that great, and so a PPO may be better. Or if someone has multiple health needs and sees a bunch of different specialists, maybe an HMO isn't the best idea and a PPO would be better. So there's really a lot of decisions to be made, and it's challenging because you say, oh, you need to know how to pick a health insurance plan, but all of these small pieces are going to play a role. Now, I mentioned that the largest number of Americans get their insurance through an employer. So it begs the question, what does somebody do if they have to leave their job due to a serious illness? COBRA is the federal law that allows eligible individuals to keep their existing employer-sponsored health insurance after experiencing a qualifying event. So the benefit is that for people who work for employers with 20 or more employees, they have the option to keep the exact same health insurance plan, which can be really useful if somebody's in the midst of treatment. The downside is that it can be very expensive because employees are now responsible for 100% of the premiums, plus sometimes a 2% administrative fee. Now, the length of time you can keep COBRA is going to depend on the qualifying event. If the employment is ending, so there's someone leaving their job, then they're going to get COBRA for generally up to 18 months. If instead, let's say somebody is aging out of their parent's plan, they'd get COBRA for up to 36 months. Now, for people who work for smaller employers and aren't eligible for the federal COBRA statute, they may want to look at their state COBRA law. The laws definitely vary state to state, but what this means is if you work for that smaller employer and you live in one of these states, you may have access to state COBRA coverage. Now, when the Affordable Care Act was passed, a lot of healthcare professionals would say to me, why would I ever send somebody to COBRA? It's so expensive when they can just go get a new plan. And that is a valid argument. But if you think about these high-cost medical conditions, someone very early on in the year may have already met their deductible or their out-of-pocket maximum through their employer plan. And if that's the case, then it may actually be more affordable for them to figure out how to pay those higher monthly premiums with COBRA and know that that's all they're going to pay for the rest of the year, instead of going into the marketplace and finding a totally new plan and starting out that deductible and that out-of-pocket maximum all over again. And then also sometimes coverage through an employer may be better or may have a network of providers that's more appropriate for that person. So in many circumstances, it may be really beneficial for somebody to elect COBRA versus getting a new plan. So we just want people to not completely discount it as an option, but to do the analysis, which we'll talk about before the end of the hour. Now, the next largest group of Americans get their insurance through the government plans. One of the biggest of those is Medicare. Medicare is the government plan that's for individuals who are over the age of 65 or have been receiving Social Security disability insurance for 2 or more years, or have end-stage renal disease or ALS. I will say that Medicare.gov is an incredibly useful governmental website because Medicare is confusing. It's challenging to understand, it's hard to navigate, but it's not impossible, and we have some resources to help you do that. Now, there are actually 4 parts to Medicare. Part A is your hospital inpatient insurance. For many people who have worked and paid into the system throughout their working years, Part A will be premium free. Now, Part B is your medical insurance, and that's going to cover doctor's visits and lab tests and immunizations. Even if you worked and paid into the system, you'll pay a monthly premium for Part B, which for most people in 2020 will be about $144. And there's an annual deductible of $197. Now, when we talk about Part A and Part B together, that's often referred to as original Medicare, because that's all that exists when Medicare was first passed. Now, Part D is prescription drug coverage. And Part D plans are sold through private insurance companies. And so the costs are going to vary plan to plan, but they cannot have an annual deductible of more than $435. And then there are some financial savings programs for individuals with lower incomes to help deal with those out-of-pocket costs from Part D. But it turns out that trying to keep track of potentially 3 different premiums and 3 different deductibles and 3 different plans can be a lot to manage. So an alternative was created in Part C, otherwise known as Medicare Advantage plans. And these plans are again sold through private health insurance companies, so Humana, Blue Cross, Aetna, and they're going to give you all of your Part A and your Part B services bundled, and many will also include prescription drug coverage. So it's trying to simplify the Medicare process, but there are again some pros and cons. Part C plans are going to have a small network of providers compared with Medicare, original Medicare, where you can see any provider around the country that accepts Medicare. So that is the quickest description of Medicare I've ever given, but please know that we have many resources to help you understand Medicare, including a recorded webinar that's on our website right now, with the caveat that it still has old numbers because it's an older webinar, but we're also going to be doing an updated one in September, right before Medicare open enrollment. So if you or somebody you know has to make some Medicare decisions, this may be something worth checking out. Now, the Patient Protection and Affordable Care Act was an attempt to address the inadequacy of insurance plans, to try to improve some consumer rights, and really to increase the options for individuals with pre-existing conditions. Congress passed the ACA and it was signed into law on March 23rd, 2010. It has had many names over the last 10 years, including Obamacare or the ACA. And this really is a behemoth law that has been incredibly politicized. And while it's certainly not perfect, it did do quite a few things to improve rights and options for individuals with pre-existing conditions. So some of these new provisions include covering the routine costs of participating in clinical trials, making sure that certain preventative services are covered for free, making sure there aren't dollar limits on the amount that they're going to pay out for somebody's healthcare costs. And this doesn't just impact people who purchase their own insurance or people with lower incomes. This really impacts most of us as consumers. One of the other things that the ACA addressed was the fact that many individuals will face a claim denial at one point or another. And this is especially true when somebody has had a diagnosis of a serious illness. It's crucial to understand that we don't necessarily have to take no for an answer. Insurance companies have an internal appeals process, and of course the details will vary based on the insurance company, but it's an opportunity to go back to that insurance company and say, please reconsider my claim. Now, thanks to the ACA, all states are now required to have an external appeals process. This is sometimes referred to as independent medical review or IMR or EMR. And again, the details are going to vary state by state, but for more information, you can certainly contact your state's insurance agency. And we have all of that information compiled on our state resources page. But the reason it's so important to consider appealing a denial is because somewhere between 30 to 60% of all appeals are decided in favor of the patient. So that's more than half the time that insurance companies are denying claims and getting it wrong. And we also know that an abysmal percentage of claim denials are being appealed. So when we're talking about dealing with the financial impact, this is a really important step for somebody because we don't want them paying for a medical bill or a prescription drug service that the insurance company really should have covered. Now, if the ACA did nothing else except these two things, it would still be game-changing for somebody in the cancer community or somebody with any serious medical condition. And the first thing it did was it said, insurance companies can only look at 4 things when they're deciding what they're going to charge someone. Are you buying an individual plan or a family plan? Certainly family plans will be more expensive. Your geographic location, which is based on zip code. Your age. Now, certainly the older you get, the more they can charge you, but now there's a cap on how much more they can charge you. And in most states, if you use tobacco, you can be charged more. Some states have decided to eliminate this tobacco provision. Then it went one step further and said that insurance companies can no longer deny selling somebody a policy or covering services related to a pre-existing condition. Now, I've been doing this work for many years now, and I never thought that this was going to happen. And we spent a lot of time prior to 2014 trying to piece together health coverage for individuals once they've had a pre-existing condition. And this provision really changes the game. Now, over the last couple of years, I've mentioned that the Affordable Care Act has been very politicized, more than probably any healthcare bill in history of the United States. And there have been a lot of talks about repealing the ACA and getting rid of it, and many people have said, but we like the pre-existing condition protections. When pushed further, a lot of those elected officials were only talking about number 2. And in our opinion, just having number 2 without the protection of premium rating, it isn't really protection at all, because now I can be priced out of purchasing a plan based on my pre-existing condition. So in our opinion, these two provisions really have to be coupled together in order to continue being a true provision. Now, there are lots of things happening all over the country about the ACA and about these protections. We are currently waiting for the Supreme Court to hear a case arguing that the ACA is unconstitutional, but certainly I will get to that in just a few more minutes. Now, as an attempt to stabilize the health insurance market and incentivize purchasing health insurance, the ACA instated what's called an individual mandate. This means if someone chose not to have health insurance and didn't fall into a long list of exemptions, they would have to pay a fine. Now, in the most recent tax legislation that was passed a few years ago, Congress dropped that penalty to $0 starting last year. So the requirement still exists, but the penalty has been dropped to 0. And this provision of dropping the penalty to 0 is what triggered the latest lawsuit. Now, some health insurance companies sell something referred to as a short-term plan. Sometimes they're called junk insurance. And these plans are relatively attractive to people because they have a very low monthly premium. But we want people to be very wary of these plans and make sure they understand what they are buying, because these plans are not required to provide the consumer protections that are included in the ACA. And they're able to deny selling to individuals or exclude treatments for pre-existing conditions like cancer. Also, with these plans, they have a really cheap monthly premium, but then they have high out-of-pocket costs when you actually try to go use that plan. So you have minimal coverage and you're going to end up paying more in the long run. Also, these plans are not considered creditable coverage, so they're not required to renew the coverage, and they can end mid-year. And if they end mid-year, it doesn't trigger a special enrollment period to buy a new plan in the marketplace, which what we are seeing happening is it means it leaves people uninsured in the middle of active treatment. Now, these plans were supposed to be eliminated eventually under the ACA, but actually we're seeing them grow now. And Health and Human Services put out a final rule that allows people to buy these plans that last up to 364 days. So again, just 1 day short of having to comply with the ACA. Now, the biggest challenge about these short-term plans is that it is not always clear to consumers that that's what they're buying until they go and use the plan and find out that it doesn't cover all of these things. So it may still be an important option for some people. The original purpose of these plans was to help bridge gaps. For example, if someone's changing from job A to job B and job B imposes a waiting period till their benefits kick in, a short-term plan might be a great option. But for someone who has a serious medical condition, again, we really just want people to be aware of what they are buying. Now, switching back to one of the government programs, Medicaid is a program for individuals with low income and low resource levels. And prior to January 1st of 2014, they also had to be able to walk through one of these 4 doors. In the cancer community, the most common door people would walk through is the age, blind, and disabled program. But there were some significant challenges with this program because many people ran into the problem that even though they were coping with cancer and couldn't work and therefore had a low income, they usually had too many assets like a retirement or a savings account, for them to be eligible. So they literally have to spend down those assets in order to qualify, usually pushing them into financial ruin. So the ACA tried to address this by creating a fifth door, and this is for individuals with incomes at or below 138% of the federal poverty level. So in dollar terms for this year, it's people who are making a little over $17,000 a year. With this new option, there's no asset test. It's just about income. When the ACA was written, the idea was that this would happen across the country. But the Supreme Court decision essentially made it voluntary for states, which means that states had the option as to whether or not they were going to expand their Medicaid program. And this is where we stand today. We have a situation where 37 states and DC have expanded their Medicaid program and 14 haven't. This is very fluid. You can see all of the footnotes here, which indicate states that expanded after the original expansion opportunity. And the states indicated here in red are ones that are doing other things with their programs. For example, some are instituting work requirements. So again, this is probably the most fluid, ever-changing slide of the presentation, because as new elected officials and Congresses and state legislatures change, the state's decision changes as well. Now, the ACA also created health insurance marketplaces. When the law was written, these were referred to as exchanges, but it turns out no one knew what an exchange was. Unfortunately, most people don't understand the marketplaces either. This was a marketing issue, I think. Now, the easiest way for me to explain marketplaces is they're a shopping mall for health insurance or Amazon for health insurance. What you are buying in the marketplace is health insurance policies sold by private companies. So they fall into this top level of our triangle of coverage. They're private insurance companies. So sometimes people say, well, why would I buy through the marketplace when I could go just to the insurance company? And the reason is there are some additional benefits to buying through the marketplaces. All of the plans sold in the marketplace have to provide essential health benefits. So there's some quality control. There's also a cap on the out-of-pocket maximum. And this year, for an individual, out-of-pocket maximums cannot be more than $8,150 for an individual or $16,300 for a family. This has been the largest increase we've seen from year to year on the out-of-pocket maximums, and it is a lot of money. But if you think back to our example of Dan, these out-of-pocket maximums are still significantly better than having no insurance at all. Now, there also is some financial help available to individuals. So this financial help is based on household size and income level. There's two different types. Premium tax credits reduce the amount that you're going to pay monthly for that premium. And then there's cost-sharing subsidies, also known as reductions, that are going to help reduce things like your copay, your coinsurance, and your deductible. Now, the marketplace also tried to simplify the shopping process for consumers by grouping plan options into categories based on their cost share amount. So bronze plans have a 60-40 cost share. Silver are a 70-30, gold are 80-20, platinum are 90-10. Now, bronze plans are going to have the lowest monthly premium and then the highest out-of-pocket maximums. Platinum plans will generally have the highest monthly premiums, but typically the lower out-of-pocket costs. So now consumers can shop for and sort their health insurance options, much like we do for appliances or clothes or frankly anything else we buy on Amazon. You know, you're looking for a black sweater, you click black, you're only going to be looking at those black sweaters. Same concept applies here. If somebody's incredibly healthy and just wants a bare bones plan, they can say, only show me the bronze plans. Or for the people I frequently talk to in the cancer community, they see the doctor every 10 seconds. They say, I'd rather pay more monthly and know that my costs are going to be capped sooner. So only show me the platinum plans. Now, I mentioned that there's some financial assistance, and this is how it all plays out. in those states that have expanded their Medicaid programs, people who have incomes up to 138% of the federal poverty level will be eligible for Medicaid. Then people who have incomes between 138 and 250% will be eligible for a cost-sharing subsidy if they choose a silver plan. And then for people who have incomes between 138 to 400% of the federal poverty level, they'll be eligible for those premium tax credits. So there are some people that choose a silver plan that are eligible for both a tax credit to lower their monthly premium and a cost-sharing subsidy. Now, things look a little different in those states that have not expanded Medicaid because that's not an option anymore. So now the cost-sharing subsidies go down to 100% of the federal poverty level, but the premium tax credits stay the same. And the problem with this is that it's the premium tax credit that gives people the ability to buy the plan. And once you have the plan, those cost-sharing subsidies become very useful. But if you don't have any help buying the plan, the cost-sharing subsidies can be less helpful. So this was an unintended consequence of the Supreme Court's decision. Now, I am absolutely guilty of talking about the marketplace as an online tool, and it is. But it's not just online. There's a toll-free hotline. You can get a paper application. There are in-person assisters that can help people enroll in these policies. But I will say there's been a couple of changes in the last couple of years. The first is that there has been a significant budget cut by the administration to fund these assister organizations. And many of them are nonprofits and rely on those federal funds in order to pay the people doing the work. The other challenge is that this administration has required assisters to tell people about their options to buy short-term plans as well. And many nonprofits in the healthcare space recognize the challenges with short-term plans and didn't want to do that, and so they've actually declined the federal funding. So in order to see if there are assister organizations near you, you can go to this website on healthcare.gov, but please make sure that you call ahead of time to make sure that they're still open, as we're not sure how frequently this website is updated. Now, when you can enroll in a plan is going to depend on what type of policy you have. Medicaid applications are accepted year-round, so as soon as somebody becomes Medicaid eligible, they can apply. Open enrollment for 2020 is closed. For 2021, we anticipate open enrollment to be the same as last year, which was November 1st through December 15th of this year. And plans are a calendar year, which means they will start January 1st of 2021. Medicare also has an open enrollment every single year between October 15th and December 7th. And employer plans are going to vary, but many employers also have an open enrollment period in the fall for then it to be a January 1st start date. But thankfully, the ACA recognized that things don't just change during those open enrollment periods, and they created a special enrollment period, which is when you have a life-changing event that results in you losing coverage. You actually have 60 days to make some decisions. And if you're losing your employer-sponsored insurance, you may have several different options to choose from. So lane one might be COBRA or state COBRA, where you're keeping the exact same health insurance that you had through your employer. And we talked about why that might be useful in terms of have you already met your out-of-pocket maximum or the coverage. Lane two is the marketplace special enrollment, where you are going in and picking a totally new health insurance plan through the marketplace. Lane three may be another group health plan that you're eligible for. So if your spouse has a group health plan, or if you're under the age of 26, maybe you can go on your parents' health plan. And then lane four is maybe you're eligible for Medicaid or Medicare now based on your changing circumstances. But the trick with all of this is that you have to pick a lane and stay in it until your next open enrollment period. You don't get to choose COBRA for a few months and then think, oh, wait, it's too expensive. Now I want to go into the marketplace. You really only have that 60 days to make your choice, and then you're in that lane until the next open enrollment period. So that begs the question, okay, I have all of these choices. How do I actually make these decisions? So if you are interested in the marketplace, you would start here at healthcare.gov. But if you just go to healthcare.gov, this is what you're going to see. If you go to healthcare.gov/C-plans, you can actually just look at what your potential options might be without having to create an application or really include any personally identifiable information. So this can also be really helpful to any healthcare professionals that are listening who are trying to help their patients through these programs. Now, I'm going to go through an example using the marketplace, but this analysis is relevant whether you're deciding between two marketplace plans, whether you have two plans through your employer to choose from, whether you're trying to decide between a marketplace plan and an employer plan, or even if you're trying to decide between two Medicare plans. The same analysis is going to apply. So here we have three different options. We have a bronze plan with a $294 premium, a $7,400 deductible, and an $8,150 out-of-pocket maximum. We have a silver plan with a $376 premium, a $0 deductible, and an $8,150 out-of-pocket maximum. And then finally, a gold plan with a $432 premium, a $1,200 deductible, and a $5,900 out-of-pocket maximum. So just by looking at these numbers, are we able to figure out which is going to be the least expensive, assuming that we're going to hit our out-of-pocket maximum? And again, generally speaking, when I'm talking to folks in the cancer community, they're going to hit their out-of-pocket maximum. Well, I certainly cannot tell just by looking at these numbers. I have to do the math. And the way that you do the math is you take that monthly premium and you multiply it by 12 months in a year, and then you add the out-of-pocket maximum. And when you do that, you see that in fact, that quote-unquote expensive gold plan with the $432 monthly premium ends up being about $600 cheaper at the end of the year. But what's interesting about this is we do this math all over the country and it never comes out the same. Sometimes the bronze plan is going to be the least expensive when the year, comes to an end. But there are some other things that we have to consider. So what are the costs? It's not just about that total annual cost. If you remember, that silver plan had a $0 deductible, which means that the plan is going to start picking up costs right away. The gold plan had a $1,200 deductible, but that's still significantly better than the bronze plan. And it's typically easier for people to pay a little bit more each month than to come up with a big check to meet that deductible. Also, you could have the cheapest plan that exists, but if it doesn't cover your doctors and hospitals and labs, then that's not going to be a helpful plan at all. You have to make sure that those doctors and other providers are covered by the plan that you choose. And then certainly to understand the prescription drug coverage. Which drugs are covered? Is there a separate drug deductible? Are there tiers that you need to understand about your drug's formulary? And certainly I think that talking with your healthcare team can be very useful in this respect, not just about the drugs that you're taking right now, but if they can anticipate any drugs that you might be taking in the year coming, you can also check your formulary for that as well. And I know NeedyMeds has some great information about this too. We also, if you are interested in hearing that example again about the math matters and how to do the math, it is in one of our animated videos that's available in English and Spanish called Picking a Plan. Now, I mentioned that it's important to understand if the plan you are looking at covers your doctors, facilities, and drugs. Well, the marketplace has actually given us a way to do that. If you're purchasing a marketplace plan, in that you can actually plug in your prescription drugs and your doctors, and it can help you narrow down those options. So this again is just the direct website to find that animated video, both on health insurance basics and on how to pick a plan if you have some questions about that. Now, you've been listening to me talk for almost an hour, and again, we really just scratched the surface on all of the legal and practical issues. So these are the different issues that we have information on our website about. We have a lot on health insurance, but also on disability insurance and employment issues and finances in general, because as I mentioned at the beginning of the hour, all of these things are going to come into play when we're talking about big picture, how to deal with the financial impact of a serious illness. So I'm going to turn it back over to Carla, and I'm happy to answer questions as they come. But certainly, in addition to connecting with NeedyMeds, we hope that you'll also connect with Triage Cancer and utilize our resources to your benefit. So thank you so much, and I'll hand it back to you, Carla.
Monica, thank you so much for that very thorough and super important presentation. It really gives the NeedyMeds audience a real taste of why we are so proud of the relationship we had with Triage Cancer. I'm going to go ahead and leave up this slide just for a moment because there's a lot of information on there before I grab the screen back. But I think what Monica said also is that she just touched the surface on some of these really important issues. And one of the things you'll find that Triage Cancer does, Monica and her team really well, is they take really complicated issues, important issues, and break them down into bite-sized chunks so you're able to understand them and make the decisions that will be most suited for you and, of course, your family and loved ones. So with that, I want to go ahead and grab the screen back. And as Monica also pointed out, you can type in any questions you may have into that question section of your GoToWebinar control panel. And I'm pleased to see questions are already coming in, but not surprised. And Monica also mentioned that NeedyMeds is a source of healthcare savings. We do know, since we're talking about insurance coverage, certainly insurance, you can find one that will cover all of your needs. And hopefully that will happen in the event you or your family members, your loved ones, your patients or clients are not getting the coverage they need. We do hope that you turn to NeedyMeds as a source of support. I mentioned in the beginning that NeedyMeds is a national nonprofit, and we connect people to programs that will help them save on their healthcare expenses. What you're looking at on your screen now are some of our most popular and effective ways to save on your healthcare costs, which includes but is not limited to medications. And if you do need that assistance or like to learn more, please visit NeedyMeds.org, our website, or reach out to our expert call center counselors at 1-800-503-6897. And while I have you as a captive audience, before we get to the questions that are coming in, one of the other things that we do try and do, as you heard in our mission statement, is to educate NeedyMeds friends and users. And we do that one of the ways we do that is by populating our calendar of events with webinars we think you'll be interested in. There's a few that are coming up in the beginning of April, so please do register for those and learn more about those. And you can find those on our calendar of events on the bottom right hand of our homepage or under that Advocates tab. As promised, I want to leave the contact information up for Triage Cancer and NeedyMeds. And I know Monica's presentation, the PowerPoint presentation, had a lot of information, including additional ways to reach out to and stay connected with Triage Cancer. So I will remind you that if you would like copies of these PowerPoint presentations, you should be able to drag and drop those in the handout section of your GoToWebinar control panel. If you're having difficulty with that, don't hesitate to reach out to me. You could shoot me a message in that question section or drop me an email at carla@needymeds.org. That's Carla with the C at needymeds.org. And I'd be happy to email you copies of these as well. And a reminder that we will work to convert this presentation into a video to be posted to our YouTube channel. So don't forget to subscribe to that. So with that, let's go ahead and leave this contact information up and get to some of those questions that are coming in, Monica. One of them, which you probably get a lot, is I have insurance through my employer, but the policy doesn't cover the doctors I want to see. Am I stuck?
So that's a really common question, and I think it comes from we've had so many decades where if we were lucky enough to have an employer-sponsored insurance we held on to it because we really didn't have very many options. But now, post-Affordable Care Act, we do have some more options. And so if somebody has an employer plan that's not meeting their needs, they're not required to keep that plan. They can absolutely go into the marketplace and shop for a plan that is more appropriate for them, with the caveat that in most circumstances, they're not going to be eligible for financial assistance. So they can absolutely deny the employer plan, buy in the marketplace, but just know that they're not going to be eligible for financial assistance.
Thank you so much. And another question coming in, and I really do like when our audience participates like this because I often feel that if a question is on one person's mind, it's probably on a few people's minds. So another question coming
Definitely.
in, again, is probably something you get something you probably get quite a bit also, is the question of, I am offered insurance through my employer, but every year I feel like I'm paying more and more out of pocket. Do you have any suggestions?
Well, I think that a lot of people feel like they're paying more for insurance lately than they have in the past. And that's true of many things, right? Costs for the same thing go up year after year. But also what we saw happen post-Affordable Care Act was in the cost of policies went up because the quality of that plan also improved. So yes, you're paying more, but ultimately you should be getting more as well. Now, if somebody feels like they're paying a ton for their policy, but they're not really getting what they need out of it, again, I would say look around at your other options. Every single year during open enrollment, we all should be looking at all of our options. So what's offered to us through our employer? What are our options in the marketplace? Is my spouse's policy better than mine for all of us to be honored, or do we have a split family? So we really have to be doing this analysis every year. Unfortunately, picking a health insurance plan is not a one-time job, but to do the math on all of our different options and to look at all of the different providers and prescription drug formularies to ultimately be making the best decision for that year.
Thank you so much, and I really appreciate that you continue to stress that this is making a decision for this year. And I think a lot of us, we have made the decision, we picked a health insurance plan, we're done with that. When the reality is that even if you're doing well, it doesn't hurt you to take some time to reevaluate whether or not that plan is still meeting your needs and the needs of your family.
I really can't, you said it perfectly.
Oh, good. And I think that's, and again, this is another lesson that I've taken away personally from Triage Cancer, because it really, a lot of the tips, although we're focused on those struggling and diagnosed with cancer, a lot of these tips, and I hope everybody will agree, is certainly applicable to everyone. So it's worth sharing this webinar and the PowerPoint presentation with those you love, and maybe if you are a healthcare provider, to those you assist, just to at least have this in the forefront of their minds. So this question coming in is for NeedyMeds, and if I need help affording meds, where should I start my search on NeedyMeds? So I'm so pleased to have an opportunity to just do a little plug on NeedyMeds. And again, our website is NeedyMeds.org. Now, on that homepage, on the top left-hand side, you will actually see a box for drug search, and you could always begin your search for cost savings by typing in the name of the medication, whether it's name brand or generic, into that drug search bar and see what comes up. You can also click on that patient savings tab, and a whole bunch of different categories will come up. And those are different ways to search for help affording your medication, your other healthcare expenses, or costs related to a particular diagnosis. So I would say begin your search on NeedyMeds.org, but you can always reach out to our expert call center counselors. The phone number on the 800 number is on your screen right now. I will remind everybody that we are here Monday through Friday, 9 a.m. to 5 p.m., but keep in mind we're in Massachusetts, so that is East Coast time, And I also want to let everybody know that we do have Spanish-speaking counselors as well. So we do try to keep the question segment of the presentation brief. So if we didn't get the chance to answer your specific question, we will follow up with you via email, or of course, you can always reach out to NeedyMeds or Triage Cancer right away. With that, I want to thank everybody for making the time to join us today, and of course, thank Monica for sharing her expertise with the NeedyMeds audience. NeedyMeds is so proud of its relationship with Triage Cancer. Thanks, everyone, and have a great rest of your day.